Welcome to this short film that will explain the way we need to work with children and young people with special educational needs and disability. What makes a good worker for children and young people with SEND? This is what children and young people said.
Hello, my name is Harry. I like people working with me to be happy.
My name is Sean. The teachers are fantastic.
Hi, my name's Jess, and really I'd like someone who's nice and kind, a bit more patient than the average person, good sense of humour, that would be fun.
Hi, my name is Jake, and I want people to be happy and kind.
Hi, my name's Thomas. I want people to listen to us. I want people who really care, and I want people to show that we mean business.
Hello, I'm Gemma. I want people working with me to be happy, helpful, kind and friendly.
Hello, my name is Jeffrey. I would like people working with me to be happy, kind and friendly.
In September 2014, the biggest reform of special educational needs and disability legislation for 30 years came into force. Included in this legislation was a new SEND Code of Practice and a wealth of guidance around new ways of working. This new legislation puts the child or young person firmly at the centre of everything, focusing on their aspirations and outcomes. In order to do this, services need to work together. The following need to be considered: early identification and support, skilled knowledgeable staff, transparency, choice and control, higher aspirations and better outcomes, and an integrated single plan for 0 to 25 years. Early identification and support. All children with SEND should be identified as early as possible, and settings should work with children and their families to ensure the right support is put in place. Skilled and knowledgeable staff. All staff who work with children and young people should have the skills and knowledge to recognise and support children and young people with SEND. Transparency, choice and control. Parents, carers and young people should know what they can expect from educational settings and services. They should be offered the chance to shape the support they get to fit their priorities. Higher aspirations and better outcomes. We should have high aspirations for children and young people with SEND, with a greater focus on life outcomes, including work, healthy lifestyle, independent living, and being part of the community. Integrated single plan. For those children and young people with the most complex needs, there should be a single assessment and plan put in place, which in some cases will last from birth to the age of 25. Graduated response. The Children and Families Act 2014 and Supporting Code of Practice make it clear that early year settings, schools and colleges have to meet the needs of all children and young people with special educational needs. Actions can include staff ensuring provision is in place and that all barriers to learning are removed, informing the family and working in partnership with parents and carers to proactively involve them in decision making and planning, and ensuring provision is reviewed at least termly and involve the pupil and their family. Services for everyone. Services for everyone are sometimes called mainstream or universal services. Anyone can access these, and they should be inclusive and supportive of children and young people with SEND. Targeted services. Some services are targeted at particular groups or types of disability, but you do not need an education, health and care plan to access them. Specialist services. Access to specialist services like social workers, paediatricians and educational psychologists are only available for the children and young people with the highest level of need, and they require assessments of need to access them. Reasonable adjustments. So what does this mean? We must give some thought in advance, if possible, as to the adjustments that might need to be made to prevent children and young people with SEND from being disadvantaged. Simple things we can change, like is it too busy? Is it too noisy in the room? Can we adjust the lighting? Is it too bright in the room? Timing of appointments. Could the person benefit from a longer appointment, or could the time of the appointment be at the beginning of the day or the end of the day? Think about how we communicate. Are we using too much jargon? Are we using tools like Braille, one-page profiles, easy read documents? The local offer sets out a local offer of all services available to support children who are disabled or who have a special educational need in their families. Search your council and local offer to find out what is available in your area. Your responsibility is to look at your local offer and to understand how it can help children and young people with SEND. Thanks for watching this video. So what's next? Well, it's your responsibility to go back to your workplace and put into practice what you have learnt from this film about supporting children and young people with SEND.